Hello, good morning to World Parkinson's Program Facebook Live session. Please join us and feel free to ask your questions about Parkinson's disease. We will be taking questions and try to answer to the best of our capability. Please keep in mind that these sessions are for educational purposes only, and the treatment of patients is up to their own neurologists. And also please note that from next week we will be changing the time. These sessions will be held on Saturday 3 p.m. Eastern Standard Time. So in Toronto time, 3 p.m. every Saturday, we will be having Facebook Live sessions. These are interactive sessions. Please feel free to ask questions. Please interrupt and also provide your comments, and kindly let us know where you are from joining us. And also forward these links to your friends and others you know. They might find these useful and helpful. We have a question. What are common sleep problems in Parkinson's disease? Sleep problems are seen in more than half of patients with Parkinson's disease. However, they usually don't happen in the beginning of the disease. In first couple of years, patients don't experience any major issues with their speech. But as time goes by, patients start noticing that their speech has started getting affected with Parkinson's. However, some patients may not know whether the speech problems they are experiencing they are due to Parkinson's disease. For example, in some patients, the speech may become soft. When the speech becomes soft, they might think that they got sore throat. So because of this hoarseness of speech or softness of speech, they might go to see their GP, and sometimes they could be prescribed antibiotics or mouthwashes or gargles, and in spite of use of antibiotics for weeks and weeks, their speech does not improve, and it keeps on going hoarse and soft. So they see their neurologist, and then they notice or they educate them that this is due to Parkinson's disease. So softness of voice. The voice may become soft, the volume of the voice may become less, and then the speech may start getting slurred. Intermittently, they may have problems with the pronouncing the words, or the words may be cut or divided into pieces, and sometimes they may have trouble articulating letters or words which are starting from letters such as P or D or T. So they may get stuck. It may feel that they're stammering or stuttering at those words, and sometimes the patients may freeze and they may have start hesitation on any word. They may have difficulty. They might try again and again, and then after a few attempts they will start speaking. In other cases, they may lose tone of speech. The normal variation in tone, which also is reflective of a person's emotions. That tone may be lost, and their speech may seem as flat, and they may not be able to vary they may not be able to vary the tone of their speech. So these are common speech problems, and also the volume of the speech decreases as disease progresses. Patients start taking less and less part in conversations, or they might become dependent upon others to speak for them, and with further progression of the disease, their content of speech is reduced, and they don't take part in conversations when the whole family is together. There are speech muscles in our throat, the vocal cords. So various causes has been attributed to cause these speech problems, such as bowing of the vocal cords, or their stiffness, their incoordination, and their movement become decreased. So patients may be asked to repeat themselves. They may be asked by the listener, say it again, or excuse me, or pardon. This may make them feel embarrassed, and these patients may start taking part less and less in the social events and going out, because they got to be asked to be repeat again and again, and people feel as if they can't understand them. So there is a social impact of speech problems on these patients. Not much help is provided by medications to these problems. The consultation with the speech therapist is very important. Speech therapists have various programs such as Lee Silverman technique and many other programs they use. They focus on patients' individual problems. Suppose if patients have a low volume of speech, and so they would ask them to speak very loud, and they would engage them in certain practices so that their speech is retained, and they develop this habit of speaking in a loud voice which other people can understand. And if patients have short rushes in speech, some patients will speak very fast, and then they will get stuck, and they will not be able to speak again, and then they would take a break and start speaking again. So in these patients, they focus on reducing the speed of speech. They might tell patients to speak one word at a time, because they are having short rushes. They are mixing up words. Their speed is much faster. So once they start speaking in a very slow speed, people are able to understand them. So strategies like this are used. These patients have practice sessions of speech therapy to half an hour or an hour a few times a week, and these sessions go on for several weeks, and the effect may not be very much long lasting, but after a few months or sometime, these speech therapy sessions may need to be repeated. Please join us and ask us any questions related to Parkinson's disease, and feel free to comment, and also we would love to know where you are from, so that helps us to let us know, that helps us to understand how many people and where they are joining us from. So please go ahead with your questions. We have another question. Why does leg swelling happen in Parkinson's disease? So the question is about leg swelling in Parkinson's disease. Leg swelling happens in some patients with Parkinson's disease, although not a very common problem. There could be certain causes of leg swelling in Parkinson's patients. First and foremost, their medications should be looked at if they are causing leg swelling, because certain medications such as dopamine agonists, pramipexole, ropinirole, or other medications such as amantadine, they can cause leg swelling. So these patients start noticing that their both legs would swell slowly, their feet would be swelling, and other causes of these problems could be other than Parkinson's disease, such as heart problems or kidney problems. So in heart and kidney problems, patients may be retaining fluid, such as if they have congestive heart failure, or if they have kidney failure, or the kidney function is reduced. They are not able to get rid of the fluids from the body, which starts accumulating in the dependent parts of body, which are legs. So heart and kidney problems are one of the common reasons of leg edema or leg swelling. So other than the medications, and furthermore, because these patients are sitting stationary, they are not moving around, their legs are dependent, they are dangling their legs all day, so that causes the edema to the water to accumulate, the fluid to accumulate in their legs, which leads to leg edema. Other causes in elderly patients could be varicose veins. In varicose veins, the blood is not being supposedly the blood is not being moved back towards the heart, because the veins become less functional. That could be a cause, or in some cases arthritis. If patients have knee problems or ankle problems due to arthritis, that could lead to the swelling of the legs as well. Physicians should go through the list of the medications, the general medical conditions of the patient, and sometimes the blood test may be needed. At other times, because patients are sitting stationary, they may develop a clot in their legs. So that clot in the legs should be ruled out. Patients may need ultrasound to have this done, and sometime there could be clot which from the legs can travel up to the other parts of the body, such as lungs, and it could lead to very serious consequences. So the leg swelling in Parkinson's patients should not be ignored, and if this is determined to be due to medications, then these medications need to be stopped, and patients may need to be started on alternative medications for Parkinson's disease. Please join us in our Facebook live session. Feel free to ask any questions. We are trying to make it as interactive as possible. This is not a lecture about Parkinson's, so this is just a discussion of sharing our knowledge and experience with others. This is like a platform, interactive platform, or a forum where patients, care partners, physicians can join us and share their experience or ask any questions. So we are happy to answer any questions of people about Parkinson's disease. Kindly let us know where you are joining from, and also note that the time from next week will be changing to Saturday 3 p.m. Eastern Standard Time. Saturday 3 p.m. Eastern Standard Time. So every Saturday there will be no session next Sunday. The session rather would be on next Saturday, coming Saturday. That would be in probably 1st April. That would be April 1st. So next session would be April 1st, Saturday 3 p.m. We have a question: what is the impact of Parkinson's on driving? Is it safe to drive? This is a very important question, and it implies to many patients. The driving problems in Parkinson's disease is a broad topic, and it's as important as anything else, because it implies to our freedom. So it's a lengthy discussion, but in short, In the beginning of Parkinson's disease, most patients may not have any issues with driving. However, as the disease progresses, the patient's capability to drive may start getting affected. Patients, when they have some cognitive issues, they may have trouble with impaired planning, organization, and goal-directed activity, even before any other signs of dementia happen in Parkinson's disease. So these early changes can impact patients' driving capacity. Research has shown that individuals between somewhere between 65 to 74, they are impacted more by the traffic-related accidents, and because of these problems, although they may be subtle, patients may start getting difficulty following directions, changing lanes, or obeying the traffic signals, keeping the speed or the pace at a constant level, and responding to the changing traffic situation, responding to the dynamic of traffic while they are on road due to their slow reaction time. So these patients may make serious mistakes which can impact their driving. So for this, it's important that a patient should realize that their own safety as well as safety of other people is very important. So in this case, the caregivers of a patient, they can also help to convey their feedback to the patient as well as to their healthcare team. If the care partners feel that other people are forced to drive defensively because of patients' driving behavior, that is not a good sign. At the same time, if they notice that patients have close calls or traffic-related accidents or have made certain mistakes which can lead to serious consequences, they should discuss with the patient themselves, and they should try to have a very frank and open discussion and convey this to their healthcare team as well. Physicians should also ask questions about these issues when patients are developing signs and symptoms of cognitive dysfunction or early cognitive impairment. So the patients may be referred to take a driving test again, or some driving course or sessions. There are some driving centers in the areas where patients can go and they can test their driving. Of course, if they fail that test, then the driving center has to report them to the Ministry of Transportation according to the rules and regulations of local area. But if they need a little bit of training, so then they can do this, and they may be they may be okay to drive for certain times, and they may need to repeat that training after some time. So driving becomes an important issue. So asking the care partners, patients should ask their care partners about their driving if they ride with them, and then a joint decision should be made with the patient and the physician about the driving. Thank you for joining us for the Facebook Live session. So if you have any questions, please feel free to ask us. The next session will be on April 1st, Saturday at 3 p.m. Eastern Standard Time. We will be taking your questions and try to answer them. Please spread word to the others. And for educational information and education brochures, you can visit the website of World Parkinson's Program, www.pedprogram.org. So We will be happy to see you next week on Saturday, the April 1st at 3 p.m. Thank you very much for joining us today. Goodbye, and we'll see you next time.